Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is a widely practiced, evidence-based form of psychotherapy that addresses dysfunctional emotions, behaviors, and thoughts through a goal-oriented, systematic process. Developed from the integration of cognitive and behavioral theories, CBT aims to identify and change negative patterns of thought that influence behavior and emotions. This comprehensive overview will cover the history, principles, techniques, applications, and effectiveness of CBT, providing a detailed understanding of its mechanisms and benefits. 1. History of cognitive behavioral therapy. 1.1. Origins in behaviorism. CBT's roots can be traced back to the early 20th century with the emergence of behaviorism. Behaviorism, pioneered by John B. Watson and later advanced by B. F. Skinner, focused on observable behaviors and the ways they could be learned or unlearned through conditioning. Classical conditioning, discovered by Ivan Pavlov, and operant conditioning, introduced by Skinner, laid the groundwork for behavioral therapies that emphasized the modification of behavior through reinforcement and punishment. 1.2. Cognitive revolution. In the 1960s, the cognitive revolution shifted the focus from behavior alone to include the internal mental processes that influence behavior. Albert Ellis and Aaron Beck were instrumental in integrating cognitive principles with behavioral techniques. Ellis developed rational emotive behavior therapy, REBT, which emphasized identifying and challenging irrational beliefs, while Beck formulated cognitive therapy, focusing on changing negative thought patterns associated with depression. 1.3. Integration and evolution. The integration of cognitive and behavioral approaches led to the development of cognitive behavioral therapy. Beck's work on cognitive distortions and their role in emotional disorders provided a structured, evidence-based approach that combined cognitive restructuring with behavioral interventions. Over the decades, CBT has evolved to incorporate mindfulness, acceptance-based strategies, and has expanded its applications to a wide range of psychological disorders and issues. 2. Principles of cognitive behavioral therapy. 2.1. Cognitive model. At the core of CBT is the cognitive model, which posits that our thoughts, emotions, and behaviors are interconnected. According to this model, dysfunctional thinking patterns contribute to emotional distress and maladaptive behaviors. By identifying and altering these negative thought patterns, individuals can experience changes in their emotional state and behavior. 2.2. Collaborative empiricism. CBT emphasizes a collaborative relationship between therapist and client, known as collaborative empiricism. This partnership involves jointly identifying problems, setting goals, and working together to develop and implement strategies for change. The therapist acts as a guide, helping the client to test the validity of their thoughts and beliefs through experimentation and evidence gathering. 2.3. Structured and time-limited. CBT is typically structured and time-limited, often consisting of 12 to 20 sessions. Each session follows a specific agenda, with a focus on current problems and the development of practical skills to manage them. This structured approach ensures that therapy is goal-oriented and efficient, providing clients with tools they can continue to use after therapy concludes. 2.4. Problem-focused and goal-oriented. CBT is problem-focused, addressing specific issues identified by the client. It is also goal-oriented, with clear, measurable objectives established at the outset of therapy. These goals guide the therapeutic process and provide a framework for evaluating progress and outcomes. 3. Techniques and strategies in cognitive behavioral therapy. 3.1. Cognitive restructuring. Cognitive restructuring involves identifying and challenging negative thought patterns and beliefs. This process includes recognizing cognitive distortions, such as all-or-nothing thinking, overgeneralization, and catastrophizing, and replacing them with more realistic and balanced thoughts. Techniques such as Socratic questioning, thought records, and evidence gathering are commonly used in cognitive restructuring. 3.2. Behavioral activation. Behavioral activation focuses on increasing engagement in positive and meaningful activities to combat depression and other mood disorders. By scheduling and participating in activities that bring pleasure or a sense of accomplishment, individuals can break the cycle of inactivity and negative mood. This technique helps to reinforce positive behaviors and improve overall well-being. 3.3. Exposure therapy. Exposure therapy is used to treat anxiety disorders, including phobias, social anxiety, and post-traumatic stress disorder, PTSD. It involves gradually and systematically exposing individuals to feared situations or stimuli in a controlled and safe manner. Through repeated exposure, individuals learn to reduce their fear response and develop coping strategies to manage anxiety. 3.4. Mindfulness and acceptance-based techniques. Incorporating mindfulness and acceptance-based strategies, such as those found in acceptance and commitment therapy, ACT, and mindfulness-based cognitive therapy, MBCT, CBT helps individuals develop a non-judgmental awareness of their thoughts and emotions. These techniques emphasize acceptance of distressing thoughts and feelings rather than attempting to eliminate them, fostering a more flexible and adaptive response to psychological distress. 4. Applications of cognitive behavioral therapy. 4.1. Depression. CBT is highly effective in treating depression. It addresses the negative thought patterns and behaviors that contribute to depressive symptoms. By challenging negative beliefs, increasing engagement in positive activities, and developing problem-solving skills, CBT helps individuals reduce their depressive symptoms and improve their quality of life. 4.2. Anxiety disorders. CBT is the gold standard for treating anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Techniques such as cognitive restructuring, exposure therapy, and relaxation training help individuals manage their anxiety and reduce avoidance behaviors. 4.3. Post-traumatic stress disorder, PTSD. CBT is effective in treating PTSD by helping individuals process traumatic memories and reduce avoidance behaviors. Exposure therapy, cognitive restructuring, and the development of coping skills are key components of CBT for PTSD, allowing individuals to regain control over their lives and reduce PTSD symptoms. 4.4. Obsessive-compulsive disorder, OCD. CBT, particularly exposure and response prevention, ERP, is the first-line treatment for OCD. ERP involves exposing individuals to feared thoughts or situations while preventing the compulsive behaviors that typically follow. This process helps to reduce the distress associated with obsessive thoughts and decrease compulsive behaviors. 4.5. Eating disorders. CBT is effective in treating eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder. It addresses the dysfunctional thoughts and behaviors related to body image, food, and weight. Techniques such as cognitive restructuring, exposure to feared foods, and developing healthy eating patterns are central to CBT for eating disorders. 4.6. Substance use disorders. CBT is used to treat substance use disorders by addressing the thoughts and behaviors that contribute to substance abuse. Techniques such as cognitive restructuring, coping skills training, and relapse prevention strategies help individuals reduce substance use and maintain sobriety. 5. Effectiveness of cognitive behavioral therapy. 5.1. Evidence-based practice. CBT is one of the most extensively researched forms of psychotherapy, with a robust evidence base supporting its effectiveness for a wide range of psychological disorders. Numerous randomized controlled trials, RCTs, and meta-analyses have demonstrated the efficacy of CBT in treating depression, anxiety disorders, PTSD, OCD, eating disorders, and substance use disorders. 5.2. Long-term benefits. Research indicates that the benefits of CBT are not only immediate but also long-lasting. Follow-up studies show that individuals who undergo CBT maintain their improvements over time, often with lower relapse rates compared to other forms of therapy. The skills and strategies learned in CBT empower individuals to continue managing their symptoms independently. 5.3. Comparative effectiveness. CBT has been shown to be as effective, and in some cases more effective, than medication for certain disorders, particularly anxiety and depression. When combined with medication, CBT can enhance treatment outcomes and provide individuals with a comprehensive approach to managing their symptoms. 6. Adapting cognitive behavioral therapy to different populations. 6.1. Children and adolescents. CBT is effective for children and adolescents, addressing a range of issues including anxiety, depression, behavioral problems, and developmental disorders. Techniques are adapted to be age-appropriate, incorporating play, storytelling, and creative activities to engage younger clients. Parental involvement is often included to reinforce skills and strategies at home. 6.2. Older adults. CBT is beneficial for older adults, particularly in addressing depression, anxiety, and cognitive decline. Techniques are tailored to consider age-related challenges such as physical health issues, social isolation, and cognitive changes. CBT for older adults emphasizes practical problem-solving, social engagement, and enhancing quality of life. 6.3. Cultural considerations. Adapting CBT to diverse cultural backgrounds involves understanding and respecting cultural values, beliefs, and practices. Culturally sensitive CBT incorporates culturally relevant metaphors, examples, and interventions, and may involve collaboration with cultural or community leaders. This approach ensures that CBT is accessible and effective for individuals from various cultural backgrounds. 7. Future directions and innovations in cognitive behavioral therapy. 7.1. Technology and CBT. Advancements in technology have expanded the reach and accessibility of CBT. Online CBT platforms, mobile apps, and virtual reality (VR) are being developed and tested to provide flexible, cost-effective, and scalable treatment options. These technologies offer opportunities for remote therapy, real-time monitoring, and interactive interventions, enhancing the effectiveness and convenience of CBT. 7.2. Integration with neuroscience. The integration of CBT with neuroscience is a growing area of research. Understanding the neural mechanisms underlying cognitive and behavioral processes can inform the development of more targeted and effective interventions. Neuroimaging studies, for example, can help identify the brain regions involved in cognitive distortions and track changes associated with CBT, providing insights into how therapy induces neural plasticity and symptom improvement. 7.3. Personalized CBT. Personalized CBT involves tailoring interventions to the specific needs, preferences, and characteristics of each individual. This approach takes into account factors such as genetic predispositions, personality traits, and life experiences to create a customized treatment plan. Personalized CBT aims to enhance treatment efficacy and adherence by aligning therapeutic strategies with the unique profiles of clients. Conclusion. Cognitive behavioral therapy has revolutionized the field of psychotherapy by providing a structured, evidence-based approach to addressing a wide range of psychological disorders. Its emphasis on the interconnectedness of thoughts, emotions, and behaviors, along with its collaborative, goal-oriented, and practical nature, makes it a versatile and effective treatment option. As CBT continues to evolve and integrate new technologies and insights from neuroscience, its potential to improve mental health outcomes and enhance the quality of life for individuals worldwide remains substantial. Through ongoing research, innovation, and adaptation to diverse populations, CBT will undoubtedly continue to play a pivotal role in the future of mental health treatment. If you enjoyed this video, don't forget to hit that subscribe button and join the NI655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.